Welcome back, YouTubers, to my channel of an everyday life podcast. If you're new, I'm Aspie. I'm all about creating mental health and awareness and sharing my life stories, as well as taking you all on a journey with autism and mental health, along with fun and games, as well as educating and advocating to you. So if you're into any of these, feel free to smash the subscribe button on the bottom right hand corner, and if you're doing so, if you join me as a family on the bandwagon, feel free to also turn on the notification bell so you don't miss any future videos as I post. So as I've said before, if you're following me right now, I'm doing about the gut biomes and autism series right now that was requested by a guy named Joe Smith, who wanted this, so I'm going to do that as a shout out for just hopefully educating all about this. And as I said before in the very first video that we talked about, based on the anatomy and physiology about the gut microbes or microbiomes in this case, therefore this one's now going to be the treatment and therapies for gut microbiomes for autistic like patients. So as we know, at present there are no effective therapies for autism spectrum disorders. Basically, parents often take their children to receive intervention that's tailored to their specific needs, regardless what it may be. It's urgent to look for risk-free and effective treatments that will work in the long run. Accumulating evidence has shown modulation of the gut microbiota as a potential therapy in children with autism spectrum disorders. Probiotics, prebiotics, fecal microbiota, transplantation and diet have been getting considerable amount of attention right now. Probiotics may prevent intestinal inflammatory diseases by regulating intestinal tight junction, protein expression and barrier function. The use of fecal probiotics may provide therapeutic benefit while minimizing adverse effects. The best way to begin to heal child's gut, though, is to remove any of the foods that may be causing the problems of either leaky gut syndrome, as I mentioned before, which will be hopefully talked about in the next two videos also in this series. Just keep an eye out if you want to know more about this. So therefore, one of the main culprits usually they feel is gluten. You know, you may have heard about gluten before and how many health conscious people are eliminating it from their own diets. People seem to go back and forth on this of whether it's serious or not, but for autistic children it's completely serious for some. One study has found that a subset of autistic children showed heightened reactivity to gluten. Children with autism spectrum disorders seem to already have different gut bacteria and poor gut lining, but are extra sensitive to gluten, and gluten actually hurts the gut lining for everyone. This happens because when gluten is broken up into smaller pieces inside the gut of yours, these fragments cause the release of zonulin, which then tells you or your lining of your gut to become looser. So this all seems to be stacking up that with children with autism spectrum disorder shouldn't be eating gluten at all. But then again, it's like this takeaway method of your diet that you just eliminate certain foods in your diet that contain certain nutrients or what have you that is important. In this case, as I'm sharing with you, gluten, and then the next one is basically sesame. So that's the next big food problem for autistic children. So I'm saying that sesame has a very similar makeup to gluten and is thought to be one of the main problems people have when it comes to consuming dairy, right? Along with lactose intolerance. When it comes to healthy adults, it was hard to find studies on this if sesame affects them or not. However, it's the typical protocol for autistic children to remove sesame from their diets. Those who do appear to do better than those who don't. An easy way to figure this out is to have your son or daughter not eat sesame, which means removing dairy. I would suggest to do this for a couple of months and slowly start working on a healthy dairy to see if your child can tolerate it. Though, if you are worried about calcium intake from dairy from strong bones, don't worry, there are other alternative kind of foods that you can use, such as your dark leafy greens, which are highly recommended, that are high in calcium. On top of that, calcium is only a fact of bone health. Vitamin D and exercise are just as important. Some of the dairy foods that you'd want to start with is full fat fermented dairy from grass-fed cows, like kefir or Greek yogurt. Another option is the same style dairy but from goats, since their milk is easier to digest and contains less lactose and sesame from the get-go. When it comes to working dairy back into your child's diet, however, what you can do is mix it with some water, then rub the mixture on the inside of your child's breast before they go to bed. If they are still sensitive to the food, there will be a small red irritation on the inside of their wrist when they wake up in the morning. If not, then it's a good chance you can start to work it slowly back into their diet over time. Now, if you still want to cook with butter, and who doesn't, right, but want to avoid seasoning, go with ghee. Ghee is just clarified butter. So it has none of the season or lactose, but it is a great substitute to butter. A report has found that the stricter parents were with their children's diet, the larger improvements that they saw. Make sure you give 100% effort and train it for a long period of time. As I mentioned before, basically about the mouse study in the last part, even fixing your child's gut bacteria doesn't mean it can move back to being abnormal if you let it. Other foods to remove for good are processed and refined carbohydrates, sugars, and vegetable and soy oils, because they can cause inflammation, which impairs your child's ability to heal. Another irritant you will want to watch out for is anti-nutrients. The two worst ones are lectins and phytates. Lectins cause problems because they potentially inhibit plasma membrane repair, bind to the insulin receptors, have been shown to attack the lining of insects and bind to human intestinal lining. They make it hard for your child's body to repair itself and worsen their intestinal lining, which is already impaired in the first place. Here are a list of foods just to let you know that has the highest amount of lectins, which are your grains, especially wheat, legumes, especially soy, nuts, dairy, nightshade plants, eggplants, tomatoes, potatoes, peppers. Phytates cause problems because they bind to vitamins and minerals, which make them bioavailable. This means that vitamins and minerals that should be helping your child's body are just passing through, unable to be used because of the phytates. The ones to avoid with the phytates of these foods are your legumes, seeds, nuts, grains. These are foods that you'll want to remove at the start when your child's gut is still healing. I'd give it 1 to 3 months as an advice to you all, then you can slowly start to work these in again. Not all the time, but occasionally eating these types of foods should be okay. The last thing to avoid isn't for your child, it's for you as a parent or guardian, is to decide these diet changes as a family of implementing these. I suggest to remove maybe drinking alcohol as well. You slowly work alcohol after you follow the strict protocol for maybe 30 days cleansing. But if you want to see the effects and truly heal your gut microbiome and lining, then avoid drinking while doing this. Now, on the other hand, as I said before, the probiotics and prebiotics. Probiotics such as the lactic acid producing bacteria belonging to Lactobacillus, Lactobacilli, bifidobacteria and Saccharomyces are beneficial to the host when provided in adequate quantities. Many studies have shown that probiotics can prevent and treat a variety of diseases such as obesity, depression, colorectal cancer and Crohn's disease in animal models and also humans. In healthy women without gastrointestinal or psychiatric symptoms, the consumption of fermented milk products containing Bifidobacterium animalis, Subs-lactis, Streptococcus thermophilus, Lactobacillus bulgaricus, and Lactocus lactis Subs-sp lactis results in robust alterations in activity in the brain regions that control the central processing of emotions and sensations as observed by functional magnetic resonance imaging. Patients with irritable bowel syndrome who were treated with B. infantis 35624 reported that alleviation of symptoms such as abdominal pain and distension and presented a normalized ratio of the immunoglobulin cytokines IL-10 and IL-12. In a double-blind, placebo-controlled randomized study, Lactobacillus helveticus R0032 and Bifidobacterium longum R0175 were administered to healthy women for 30 days. And then anxiety, depression, and 24 hours free cortisol levels in the urine were then assessed. The probiotics alleviated psychological distress and the 24-hour urinary cortisol levels. In another pilot clinical study, however, patients with chronic fatigue syndrome received 24 billion colony-forming units of Lactobacillus stachy's strain Shirota daily for 2 months, and a significant decrease in anxiety symptoms and a significant increase in Lactobacillus and bifidobacteria were observed. Probiotics such as Lactobacillus reuteri and Lactobacillus rhamnosus have been shown to improve barrier function by altering the expression of tight junction proteins and decrease the bacterial translocation in animals or in vitro. Healthy human administered Lactobacillus plantarum strain WCFS1 in the duodenum enhanced intestinal barrier by regulating human epithelial tight junction protein. Patel et al. Found Lactobacillus rhamnosus GGG promoted intestinal barrier function maturation by inducing Claudin-3 expression. The Probiotic prebiotic can normalize the gut microbiota, enhance gut barrier, and relieve that autism spectrum disorder-like behaviors in animal models or autism spectrum disorder patients, as shown by a study of Hesio et al. A treatment that has been with bacterioides fragilis reduced gut permeability, alters the composition of the gut microbiota, and decreased autism spectrum disorder-like behaviors in a rodent model of autism spectrum disorders. West et al. However, found that the daily administration of the probiotic and immune modulator co-formulation Del-Pro significantly impacted GI, gastrointestinal, and autism spectrum disorder symptoms. Supplementation with a probiotic containing Lactobacillus, bifidobacteria, and streptococci normalizes the bacteroides firmicutes ratio and amounts of Desalinformio SPP in the feces of children with autism spectrum disorders are similar to those found in samples from their non-autistic siblings or unrelated healthy controls. They also found that autism diagnostic interview restricted repeated behavior subscale score has associated with the amount of Desalinformio SPP. However, the authors did not assess the alteration of autism spectrum disorder behaviors after probiotic treatment. According to a cohort study, oral supplementation with Lactobacillus acidophilus twice daily for 2 months decreases with the arabidiol levels in the urine of children with autism spectrum disorders and improves the ability to follow directions, as demonstrated through comparison with data collected before the treatment. However, the positive roles of probiotics and prebiotics in humans are controversial. In summary, probiotic and prebiotic treatment for autism spectrum disorder patients like multi-center, large sample, randomized controlled area trial. Fecal microbiota transplantation is an intervention in which the fecal microbiota from a healthy individual is delivered to a patient with a dysbiotic gut microbiota. FMT dates back to the 4th century China, when a traditional Chinese medicine doctor described an oral human fecal suspension that effectively cured food poisoning and severe diarrhea. It's highly efficacious in the treatment of recurrent Clostridium difficile infections. FMT has been applied to the treatment of irritable bowel disorder and irritable bowel syndrome, based on the speculation that FMT can normalize the gut microbiota in patients with this and improve constipation symptoms 100%. Thus, researchers are increasingly interested in using FMT to treat children with autism spectrum disorders. However, the safety of FMT should be considered. The potential adverse events of FMT include diarrhea, abdominal cramps, belching in the short term, mild abnormal discomfort, bloating, and transient low-grade fever. Microbiota transfer therapy is a modified FMT protocol comprising 14 days of antibiotic treatment followed by bowel cleansing and the administration of a high initial dose of standardized human gut microbiota for 7 to 8 weeks. An open-label clinical trial has shown that MTT improved both GI symptoms, example-wise constipation, diarrhea, indigestion, and abdominal pain, and autism spectrum disorder-related symptoms, and normalized the microbiota microbiota of autism spectrum patients. Other potential therapies such as diet and antibiotics. Children with autism spectrum disorders tolerate a narrow range of foods and exhibit more feeding problems than children without autism spectrum disorders, as clearly mentioned earlier. Specifically, children with autism spectrum disorders refuse more foods and exhibit a more limited food repertoire than typically developing children. Many parents complain that their children with autism spectrum disorders are selective eaters. Children with autism spectrum disorders reject foods for various reasons, including problems with presentation of the food, the use of certain cutlery, inclusion of different types of food on the same plate, which I clearly have shared about this on one of my videos, which I'll link in the eye about me, about the Autistic diet. Compared with the controls, children with autism spectrum disorder ingest fewer fruits, vegetables, and proteins and have a significantly lower daily intake of potassium, copper, folate, and calcium. Food intake influences the composition of the gut microbiota. Decreases in carbohydrate intake decrease the levels of Roseberia spp and Eubacterium rectal. Furthermore, diet-induced alterations in the location and composition of the gut microbiota influence the serum metabolite levels. According to an open-label trial, participants with autism spectrum disorders are treated with omega-3 fatty acids for 12 weeks exhibit significant improvements in social behaviour. However, high-dose supplementation with omega-3 fatty acids do not affect children with autism spectrum disorders, as demonstrated by a recent study. A gluten-free diet is a high-fat and low-carbohydrate diet and results in reductions in the total gut microbial counts, increased sociability. Another diet that has been introduced is the ketogenic diet, which is a high-fat and low-carbohydrate diet and results in reductions in the total gut microbial counts and that increase sociability, decrease repetitive behaviours, and improve social communication in an autism spectrum disorder animal model, which therefore basically I've shared a bit about the ketogenic diet, what you can do, and so on and so forth, which I'll link in the icard above me also. Noel et al. Found that the ketogenic diet reduces the total gut microbial abundance in fecal matter and normalizes the level of Akkermansia muciniphila and autism spectrum disorder murine model. Children with regressive onset autism who are treated with vancomycin, a broad spectrum oral antibiotic for a short period, exhibit improvements in diarrhea and autistic behaviours. Based on a prospective double-blind placebo-controlled trial, 3-month treatment with levocarnitine improves autism spectrum disorders symptoms in children with autism spectrum disorder. More clinical studies are needed, however, though, to establish the support for the use of dietary, antibiotic, and supplemental treatment. In conclusion of this review I made for this video, we have summarized all the information from multiple studies showing that abnormal gut microbiomes that is related to ASD. First, we reviewed the relationship between the gut microbiota and the central nervous system. Secondly, we defined the role of the gut microbiota in autism spectrum disorder, and finally we described some potential therapies and treatments for modulating the gut microbiota in patients with autism spectrum disorders. Many recent clinical studies have shown that treatments that regulate the gut microbiota result in improvements in the autism spectrum disorder symptoms. However, well-designed research studies with more participants provide more evidence that supports the effectiveness of these treatments, however. So this clearly ends a quick video based on what I'm sharing with you all. Hopefully you've enjoyed this. Smash the like, comment below. Feel free to comment below basically if you have any dietary requirements, be it what I've shared so far, like, you have to withhold yourself by basically doing a ketogenic diet versus maybe removal of certain foods of gluten and that. How did you go about it and how did you feel afterwards? Did it make any difference? And all for the do, guys, thanks for watching. Do what love it do. Don't forget to follow me on my social medias as it comes up, and also feel free to donate, big or small. And all for the do, guys, thanks for watching, and I'll see you again soon. Ciao for now.